I'm Jill Holt with Mountain Pacific, and this is the second of our series of It's Worth a Shot. And these series are designed really to address all things vaccine, COVID-19 vaccine related. We'd just like to take a minute to remind everybody that this is a time for you guys. It's going to be quick. It's 30 minutes. We are recording these webinars, and we'll make those recordings available on our website along with the PowerPoint slides that you'll see from week over week. We'd like you to feel free to give us any insight as to what you'd like to see on the agenda, and we'll make that happen for you. So just again, welcome, and we'll get moving along here. So next slide, please. Actually, I think you can go 2 slides forward. All right, I wanted to just start off by visiting for just a second about some Q&A that we received last week. And by the way, I hope you got a copy, but we are sending out each week a kind of an ongoing Q&A, frequently asked question sheet, so that hopefully you can reference that for future things. It's just too hard to keep up with everything that's happening. So if we can put some of this in a concise document that's a reliable place for you to be able to look, we're hoping that that helps ease some of your day-to-day struggles with trying to stay current. So last week, for those of you that were on the call, you may remember that there was a question about what to do with hiring new staff and where do they fall into this mandate. So this is a little tricky for me to answer, because when we had a call with our Wyoming Department of Health last week on Friday, they indicated that they were undergoing some training, which was to have been done this last Monday, so a couple of days ago. So I feel like it's safe for me to give you the guidance that's been posted and published in the frequently asked questions that's been made available by CMS, and this is their answer. And so they're saying that will there be different requirements for existing staff versus new staff? And the answer to that question is no. Staff at all healthcare facilities included within the regulation must have received a minimum the first dose of a 2 COVID-19 or 1 dose of the series, or 1 dose of the single series, or have completed the exemption request or requirement. That's also, I think, something that needs to be done upon hire. Also, the other language that you see here in bold is, or prior to providing any care, treatment, or other services to the facility and or its patients. So what I am taking away from that is that you can hire people who've had 1 dose in a 2-dose series, but there will be some stipulations as to what they can do in your facility once they've been hired, while they're waiting for the timeline to lapse when they can take the second of their 2-dose series to complete and become fully vaccinated. So I hope that that makes sense. Now, I want to also mention that in that link that we've provided, there is some real specific guidelines or guidance for you to be researching for what it means as far as safe practices. There's some testing components and language in there. And then again, also some indication about infection control practices that you would want those new people who have had just 1 single dose of a 2-dose series, who are, in other words, not fully vaccinated, to be aware of and part of your policies and procedures. I think the surveyors will ask that question if they come to your facility and see that you have somebody newly hired. They're going to look at that. All right, let's move to the next slide. Thank you. The last question that I want to just cover today is, how does CMS define fully vaccinated for the purposes of the mandate requirement? So the purposes of the regulation, CMS currently considers staff fully vaccinated if they've had 2 or more weeks since they completed a primary vaccination series for COVID-19. However, staff who completed the primary series for the vaccine received by phase 2 implementation date are considered to have met these requirements, even if it hasn't been 2 full weeks, or 2 full weeks of the waiting period, which we know is required for the term full vaccination. So basically what that says to me is that to be considered fully vaccinated, you have to have had 2 weeks past the completion of your primary series. However, for purposes of the mandate, you can hire somebody and they can be considered completely vaccinated if they've received the second of the 2 doses and it has not yet been 14 days. So again, there's more explicit language in that link that we've provided on this PowerPoint slide. So I hope that that's somewhat helpful when you're thinking about hiring people and determining what role they can play in your facilities. So I want to turn our attention next to the clinical office hour portion of this presentation, and we're going to welcome back Kyla Newland again for that portion. And then once she's completed her section, then Tom Vincent, who is our data analyst for Mountain Pacific, will speak to you about NHSN data reporting. So Kyla, the virtual floor is yours.
Hey, thanks, Jill. I was just going to note that someone did ask a question in the chat. Can nurses that claimed religious exemptions still provide treatments and cares to the residents?
So that, I believe that link also does address that. That's a great question, Vicki. You're right to ask that. I think there are still some restrictions perhaps and some guidance in that link, and we'll make a note of this and add more and elaborate more on next week's call. But I think that's where you'll find that explanation. Does anybody on the Mountain Pacific team have any other thoughts about that before we leave that question? Just making sure that I didn't misrepresent what I think is the case. Okay, so yeah, I think that is something to be mindful of, and there is some language, as I recall, in that link. Thank you. Thanks, Kyla.
Yeah, absolutely. So the content that I put together today is really kind of just a brief overview of each of the 3 approved COVID-19 vaccines. And thank you. Miranda's going to be sharing. There's PDFs that are from the manufacturer for each one of them. And what I did on the slides is just kind of pull in the nice visuals that give you kind of an overview of the storage and administration of each of them. And then there's also a CDC document for each one. And I wasn't sure how many of you are actually providing vaccine at this time, but these are really good resources, you know, if you're in process of signing up as a vaccine provider or will be in the future. So first we start with the Moderna. So one of the things between the 3 vaccines is there's different storage requirements. And so that can get confusing, and then the dosing, and then the vials and the expiration dates. And so all those details are included in those PDFs. But I'll just do a brief overview of what they are here on these slides. So the Moderna vaccine, you can actually keep that in your freezer, but once you take it out and put it in the fridge, it's only good for 30 days after that. And then there's guidance here on how long you need to let the vial thaw out before you actually use it. And for another thing to mention about Moderna is that there are no expiration dates listed on the vials. And so to get expiration dates, there's either a QR code on the box when you receive your vaccine, or there's actually a website, which Miranda, thank you, has just posted in the chat, where you can look up, based on lot number, you can look up expiration date of your Moderna vials. So I'm not going to go through like all the details and read this to you, but really I just wanted to give you guys these resources related to each of these vaccines. So next slide, please. We'll talk about Pfizer. So this slide has the 3 different formulas of Pfizer that are essentially currently available, but they are phasing out this purple column. So I did include that for completeness, and in case folks are still using that or still have that. But they are actually phasing that out, and they're switching to the gray formulation. So these are based on the cap and what color the cap is for each of the vaccines. So the advantage of the gray one compared to the purple one that we previously had for adults is that you don't have to dilute it. So That's really nice, and probably something that will make it much easier for you when you're administering it. And then the other thing that you'll see is the expiration date is actually going to be longer, and it's based on the storage capability that you have at your facility. So I don't think a lot of places have these ultra low temperature freezers because they're expensive, I think. And I don't know, maybe some of the hospitals, maybe some of the bigger hospitals do, but most folks are going to be receiving it, putting it in the freezer, and it will be good for 10 weeks. So that's kind of the high level on the Pfizer vaccine. And then you can see there's restrictions on how long you can keep it at room temperature and how long you can use it after the first puncture. And you'll see the difference there, that you may have been familiar with the 6 hours prior with the Pfizer vaccine or with the purple vial, and now that's extended to 12 hours. Next slide, please. And then here we have J&J, a little bit simpler on J&J because it is only refrigeration storage, and there's no freezer component. This vaccine, the J&J, as we talked about last week, is, well, I'll say the mRNA vaccines are preferred now preferentially per the CDC recommendations. So I would be curious, and I don't know if the demand will go down for J&J, but it certainly will still be available. And there are certain populations that may still want to get this vaccine or may not be able to get one of the mRNA vaccines because they have a contraindication, either an allergy or if they've had a history of anaphylactic reaction to one of the mRNA vaccines, they can get a booster with J&J. So I think that's pretty much all I have. I wanted to save some time for Tom and definitely time for Q&A. I've given you guys quite a few resources. There's the vaccine storage and handling toolkit is pretty extensive. It's for all vaccines, but the addendum on there has the specifics for the COVID-19 vaccines. And there's also information there about if you're doing a mobile clinic or mobile vaccine transfer. And there are different requirements for how long you can keep the vaccine at certain temperatures, frozen, refrigerated. And so that's something to know if you're going to be participating in any kind of mobile vaccine efforts. And then just some other resources, a training specifically from the CDC. I think you can get CE for that as well. And the Immunization Action Coalition has really good storage resources as well. And Miranda shared an additional one that just came to my attention yesterday, which is the USP, United States Pharmacopoeia Vaccine Handling Toolkit, which is similar to the CDC one, but it's specific for COVID vaccine. So questions? I would love to have your suggestions as well. If you want to chat in for future weeks on our clinical portion of the presentation, please feel free to share if there's things that you want to dive a little bit deeper into. All right, well, if there's no questions, if things come up, go ahead and put them in chat and I'll turn it over to Tom.
Thanks, Kyla. Thank you, everybody, for showing up today and listening in. I'm just going to provide a brief review and overview of reporting the COVID-19 vaccination data into NHSN. For most of you, this will be review. However, I know there are some folks out there that are relatively new to this due to maybe staff turnover or other circumstances within your facility. Next slide, please. The first thing to remember when reporting the COVID vaccination data into NHSN is that it's reported cumulatively. That is that it is looking at the total number of individuals who have ever received the COVID-19 vaccine since it became available in December of 2020. This is different than incident reporting, which focuses more on the number of new individuals who may have received the vaccine in a specific week or reporting period. And the incident vaccine data are not used for reporting COVID-19 vaccination in NHSN. Next slide, please. This is a very simplistic example of cumulative reporting. If your facility in week 1 has 5 individuals that received the first dose of the Moderna vaccine, your cumulative number of individuals then is 5. Now, week 2, you might have 5 more individuals who have received the first dose of the Moderna COVID-19 vaccine. Week 2, then you would report the cumulative number of individuals as 10. 5 in the first week, 5 in the second week. So we're making a cumulative tally as we go along. Next slide, please. Now, there are 5 key questions that you'll need to answer as you are entering your data into NHSN. And I will stipulate right now that I know that within those 5 questions, there are several parts to each question. We'll touch on the high point and briefly describe them best we can here today. So the other thing to remember is that you will be reporting or do report for residents as well as healthcare personnel in your facilities. Question number 1 asks for the current number of residents in your facility. And the residents are counted as those that occupied a bed in your facility for at least 1 day during the reporting week. Healthcare personnel are reported a little bit differently. You're looking at the personnel that are eligible to have worked at the facility for at least 1 day during the reporting week. Now, this can include employees, that is, those that actually receive a check from the facilities, and non-employees, those folks that might be affiliated and provide services in your facility, but they are not paid by your facility. And there are several categories of the non-employee. For instance, you may have the adult students and trainees and volunteers that might come in and work in your facility during the week. There is a category for licensed independent practitioners, such as physicians, advanced practice nurses, physician assistants, and those type of folks that might come in too. And of course, then we also have the ever-present other contract personnel category. These are folks that might be providing care or treatment or other services at your facility through a contract, but they really don't fit into those other categories that we previously looked at. And all of the staff categories are required to be filled in, even if it's just a 0 that you need to put in there. Next slide, please. So question 2 looks at the cumulative number of the individuals from question 1 who have ever been vaccinated with the COVID-19 vaccine. And this will be reported by whichever vaccine is given and whether or not they received either just the first dose or both the first and second dose as applicable. Excuse me. Question 3 then is asking for the cumulative number of these individuals from question 1 with other conditions. Now, these are the folks that they may have medical contraindications. There may be a reason for a refusal to get the vaccine, or perhaps they don't have their documentation showing what their vaccine status is. In any case, all these individuals have to be accounted for in the appropriate place on the form. And all individuals from question 2 and 3, that needs to add up to the number you put in for question 1. So we're accounting for all of these people. Next slide, please. Now, this brings us to the most recent addition to the vaccination part of the COVID module, and that is the booster shot or the additional dose of the COVID vaccine. This also is a required field, so please be sure that you are filling this out properly. And this is asking for the cumulative number of individuals who have received a complete COVID-19 vaccine series and who are eligible to receive either an additional dose or a booster. So if you look back at your question 2 answer for the number that received their complete COVID vaccine series, that's the number we're looking for. Now, some folks will be eligible after about a month of their COVID vaccine series, where they might receive an additional dose. Maybe they immunocompromised, or the initial vaccine series wasn't as effective as it should be. And of course, the booster is offered between 2 and 5 months, depending on which vaccine you received initially, just as the efficacy tends to wane as time goes on. And there are other criteria that might come into play when looking at the eligibility for the additional vaccinations. And I've provided a link there where you can look at the CDC's recommendation on those things. Next slide, please. That brings us finally to question 5. And we're going to look at the number, we're asking for the number of individuals from question 4 who actually did receive an additional vaccine dose or a booster since August of 2021. And as a reminder, as you're filling out the forms in NHSN, that all the required fields, pardon me, are marked with a red asterisk and a red box. And I provided a couple links here. These are instructions on how to fill out the form, whether you're when answering for the residents or the healthcare personnel. These forms, they go question by question, providing all the detail you need to answer these questions accurately. Next slide, please. Now, how do you get your data into NHSN? Basically, there are two options: manual entry. If you go to the NHSN website, which I will provide a reference for, and you can download some summary forms from the website, record your numbers, and then when you log into NHSN, you will have to enter those manually. Don't forget to push save, obviously, when you're done. And another option is a CSV data import. Again, if you go to the website, you can download and save a CSV template to your computer. It's formatted with the titles of the fields that you'll need to enter your data into. Complete the worksheet, save it to your computer, and when you log on to NHSN and you go into the vaccination summary page, in the lower left corner is a button that you can click on to upload the CSV file that you saved to your computer. It's actually a pretty slick way, and it kind of saves saves an extra step. So that's another method. Next slide, please. These are some questions that we've received recently here at Mountain Pacific regarding the data entry. And I thought I'd just review them just in case they're of some benefit to you all. The first was, is there a place to report staff or residents that have religious reasons for not getting vaccination? And yes, there is. Non-medical exemptions such as religious views or philosophical views are to be entered in the offered but declined section. And this can be found under when you're answering question 3. That's part of question 3. There's a section for that. Another question, is there any means to upload these tracking forms to NHSN instead of doing the tracking on these sheets and then having to re-enter the data manually? Good question. The CSV template so far is the only option to electronically upload your data. The others, whether you have an in-house data collection form or you download it from the website, it still has to be entered manually. Finally, does it matter if a resident received a vaccine somewhere other than our nursing home, or if they received each of their vaccinations at different locations? It does not. When you're entering the data, the question actually asks you if they received the vaccination at your facility or elsewhere. Next slide, please. So a few resources here. The top website is the NHSN website for COVID-19. This has links and anything and everything you ever wanted to know about NHSN and the COVID module. You can find your data collection forms, tables of instructions on how to fill out the forms, tracking worksheets, training slides, training videos, analysis tools, and CSV resources that we discussed earlier. The other two resources actually link into the top one. They are just specific to the vaccination portion of the information. This is where I go when I receive questions about NHSN and COVID. If I don't know the answer off the top of my head, I can find it in here. It hasn't let me down yet. So I highly encourage you to use these if need be. Next slide, please. Any questions for me? Yeah, I think we've got a couple minutes to go here. And if not today, if you think of some down the road and you don't want to look at the website, feel free to email us here at Mountain Pacific. We can usually turn around your question faster than NHSN can. So,
I see one question in chat here.
oh, okay.
How would you suggest documenting a healthcare provider that received 1 dose of 2-dose series that had an adverse reaction? Primary care provider recommends not to complete the series. The primary care provider completed the medical exemption. Should it be recorded as an exemption?
Yes, I think that would be, my first thought would be that would be the possible contraindication. But I would have to look at the form to see where that would fit in. But that would be one of those in question 3, and it might fit into that contraindication section. But I can follow up on that, no problem.
Okay, thank you. And from a clinical standpoint, I would think there would be an option to, if it was an mRNA vaccine that they got, to get a dose of J&J. And that would be the recommendations from the CDC as well. But if PCP, recommended against any additional doses, then that would obviously supersede that.
Yeah, very good. I'm just not positive how they would report that in NHSN. So.
Mm-hmm.
So this is Jill. I'm switching gears just for a second here. We've been trying to track down the answer to that question about what precautions do you need to take specifically if somebody has an exemption, and we're still working on that. We know that it's in the rules portion of the register, and we're still kind of combing over that. But I know in the frequently asked question link that we've provided with regards to the vaccine, they do just say this, I posted it in chat, that in granting exemptions or accommodations, employers must ensure they minimize the risk of transmission of COVID-19 to at-risk individuals in keeping with their obligation to protect the health and safety of patients. So I think that's kind of that's not enlightening or newsworthy so much, but that's what we've got so far, and we'll keep working. I do recall seeing something about perhaps increased testing or social distancing and certain infection control standards that might be recommended. So we'll get that out to everybody though. Well, any other questions or comments before we close up shop today with this webinar? We're so happy that you joined us. We hope that these are kind of 30-minute blasts that help you with your day-to-day work and can be useful to you. So unless anybody has any questions, we will send out the webinar link, the PowerPoint slides, as well as update our FAQs based on some of the questions that came up today. We appreciate what you guys are doing. You're working hard. Your work is important, and you're making a difference. And just keep up what you're doing and take care of yourselves too along the way. Don't forget you're important. So thank you so much, everybody, for joining today. We'll see you next week.